Yes, ma'am.
You were giving us some good information.
Right, and wanted to say, because I know our time is, it's limited and everything, but that I would like to come back at some point and tell you exactly what we're doing. We really want to, but our legislators have been very supportive. Federal, those are the ones we're working with, our federal, but really our state legislators as well. They're looking to, we've had a couple of state legislators call and ask if some way they can get some money in this next budget for us, and the city, Michael Murphy has been, I've always worked well with him, and he's been very supportive to see how we can do something to work, because you understand what happens when something like that sinks, and people believe when I actually say, well, but they don't do what we do, they're just like, oh yeah, well, we just, no, you don't.
You're right.
You really,
and this isn't
really
a
don't do
partisan
what we
issue.
do. No, you don't do what we do.
And so, I just don't understand when it comes to talking about the health of the community, how can you not want to do everything that you can, regardless of who the people are, the zip code? It's just amazing to me.
Deborah,
okay,
you know
right.
I don't mean to on my soapbox, but is the people that they're designed to make sure that people of color don't survive. I mean, look, it's all racism. It's racism. And what she's talking about doing is preventive. It's getting involved with these families and babies' birth when they're born.
Right.
Now they'll put some money in intervention after they have got the problem, and it provides a lot of jobs for people to intervene. But what you're talking about doing is the thing that we need to prevent, to get a healthy start. For these kids, all they need,
and to have a healthy black community.
And so,
it was.
Is
that a threat? Is that a threat?
That's a threat. A healthy black community.
Right, and also the things that other case managers don't do. We go to medical visits. We go to court, whether it's a criminal court or whether it's a child court, and we bumped heads there because they tried to kick us out of the court.
Right.
Now, see, Pat, I just told you, you doing too much. You providing too good a quality of service.
That's it. Okay, so I know that, but see, I don't know how to do anything else though. So I just need everybody's support to help us
that's
continue
just
to
the thing.
do that.
Well, they just don't want. And here I go again. But I read the newspaper and I got a whole stack. Well, just like the first day of school for the kids last week, and they got the picture of the little cutie pie on the front page. He's crying. Okay. But they had him with a white teacher, just like they're not black people involved there either. I mean, that's like the black can't comfort, but they keep showing these white girls taking care of these black kids as if there are no black people.
Right.
And that bothers me.
Well, and it should, because I mean, it's not an affront against what other people think. It's a reality.
Right.
Because if you don't have, my grandson, we put him in a he turned 3. We put him in a Head Start, and we had to take him out of there because they're talking about starting at preschool for the pipeline. And I'm reading that, right? And then I'm looking at my own grandson being literally emotionally abused in this place. But it was a white teacher who was the overall teacher. Now, you had some black teachers, but they didn't have any control.
Right.
And one of them pulled my daughter aside and said, you need to get him out of here.
I think the two,
that's sad.
The bookends of this discussion this morning is, on the one hand, pulling or cutting Healthy Start money to work with babies on the front end. But more than $1 billion a year is being spent on incarceration.
That's right.
$1 billion.
That is the interest. After the fact, and then look at all the folks who get the jobs.
Right.
That's right.
And the ones who's
it perpetuates.
Yes, you're right. I know that our time. How much time do we have still left? But what we got to do, well, Dr. McManus and even Attorney Hall, if you all have the time, let me know, and we can just continue this, because the both of you, what you're doing is all intersects.
It does.
And so next Monday, and the listening audience, I'm so sorry that you weren't able to get all your phone calls to come in, but you get your questions and calls ready for next week. Dr. McManus, she's going to be back to continue this, and which gives me a chance to get on my soapbox.
Okay, good.
I got time because I can really.
No, we want Dr. McManus to
get
on her soapbox.
And I want Deborah to know too that she's been surrounded by blue devils.
Amen. Yes.
Okay. There's a general in the mix. That's all I'm gonna say.
Well, we're gonna see you on next Monday.